Namaste. I am Dr. Achal Baghat. I'm a senior consultant psychiatrist and psychotherapist at Apollo Hospitals. Today, we are going to be talking about schizophrenia. We are going to talk about what is schizophrenia, what are its symptoms, how do we diagnose it, how do we treat it, how can you help yourself if you are living with schizophrenia. What is schizophrenia? Schizophrenia is a major psychiatric disorder. It affects a number of our mental functions. It affects the way we think, it affects the way we behave, it affects the way we feel, it affects the contact that we have with reality, and it affects our ability to process information, attend to information, and find solutions to problems. How common is schizophrenia and who all does it affect? Schizophrenia is not a very common illness, but it is not very uncommon as well. About 1% of people are known to be affected by schizophrenia, known to be living with schizophrenia. Schizophrenia can affect both men and women. In men, it starts slightly earlier. It affects people in late teens or 20s. And in women, it starts in 20s and 30s. What are the symptoms of schizophrenia? How does schizophrenia present itself? Schizophrenia can present itself in 3 or 4 different groups of symptoms. One would be called psychotic symptoms or positive symptoms. Here, positive does not have a positive sense to it. Here, positive means that they are symptoms of thought and feeling which are easily visible. These symptoms are delusions, where a person might have a fixed belief which may not be true, which other people around him may not think to be true. For example, they may be thinking that people are conspiring against them. They might be thinking that their mind is being controlled. They might be thinking that there is a reference to them in everything that is happening around them. These could be delusions. They could be hallucinations. The commonest hallucinations would be auditory hallucinations, where people hear things which people around them cannot hear, which they could see things, visual hallucinations, which people around them do not see. The auditory hallucinations and visual hallucinations could mean that people feel that they are hearing voices about 2 people talking about them, or they are hearing voices about somebody commenting upon whatever they are doing, and there is no other person around them. While it is their reality that they experience that, nobody else is able to confirm or share that reality. These are called hallucinations. There could also be disorganized speech that the person might have, where there could be sentences may not be coherent, or there might be within a sentence incoherence. There could be intra-sentence incoherence, that one sentence does not make sense, or 2 sentences when they said together, they do not link together with each other. What are the early signs and symptoms of schizophrenia? Sometimes it is difficult to see schizophrenia coming, and sometimes it is possible to see schizophrenia coming. For a period of 6 months before the actual symptoms start, the person might have a vague sense of distress that they are not able to explain. They might be having a confused thinking. They might have some behavioral changes, and these might be the early, or they might have withdrawal. They might also have changes of mood like irritability, or early signs of misinterpreting information around them. These are early signs and symptoms of schizophrenia. What do we mean by schizophrenia spectrum? A number of conditions which are similar, that means that they have some common symptoms, but they do not have all the symptoms of schizophrenia, could be seen as illnesses included in the schizophrenia spectrum. So the common symptoms would be delusions, hallucinations, disorganized speech, and it could mean that they could have mood changes as well. What causes schizophrenia and its related disorders? Causes of schizophrenia are not very clearly known. It is multifactorial, which means a number of things contribute to the development of schizophrenia. One, there is a biological vulnerability, which means that either before birth or after birth, there are changes in the brain that have developed which could lead to further schizophrenia-like symptoms. Two, it could be genetic in origin, that people whose family members have schizophrenia could have a slightly higher risk of developing schizophrenia. These biological vulnerabilities normally present themselves in neurochemical changes or neurocircuitry changes. Brain has many circuits where one part of the brain is attached to the other parts of the brain through connections it makes. And sometimes these connections go awry, and these neurocircuitry changes could contribute to schizophrenia. How is schizophrenia diagnosed, and can any tests be done for it? Unfortunately, where the knowledge of science is at this point of time about schizophrenia, we do not exactly know what all causes schizophrenia. There are many hypotheses. Sometimes these include prenatal experiences, a viral infection. Sometimes these include growing up experiences. Sometimes they include genetics. But as I said, these cannot be converted into biological tests that can be done to help us diagnose schizophrenia. What are the treatment options available for schizophrenia? It is important to recognize that just medicines by themselves may not be enough. Informing people about their illness, informing people about early signs of relapse, helping people structure their time, helping people feel motivated, and finding their way back into life is also extremely important. Sometimes cognitive remediation helps. Remember, we talked about cognitive symptoms of schizophrenia, where problem-solving abilities and information processing abilities were affected. Remember, we talked about socialization and schizophrenia. Asocialization and amotivation were common symptoms. Psychological treatments and cognitive remediation might help in these aspects of schizophrenia. So today we talked about schizophrenia, its symptoms, its diagnosis, its treatment, and what the society can do to help destigmatize the illness. If you develop symptoms of schizophrenia, please do consult a psychiatrist or a mental health professional. Stay safe, stay healthy, stay informed. Namaste.